Industry. We're joined today by Andrew Rubin. He's the NYU Medical Center Vice President. Nice to see you this morning, Andrew.
Good to be here.
As someone that deals directly with the health industry, what's your assessment of what's before the Senate right now?
Well, I think my assessment is we have a bill that's going to pass, pass and get reconciled in the House, and I think we're going to be done with talking about health care in terms of getting it, something signed by the President. But now the fun really starts, because we have now 3 to 4 years to put this thing together, and it's very complicated. And there's there's enough in there for people to really like, because it's going to insure a lot of people who can't get insurance right now.
And would that be good for you? I mean, would that bring more people to the medical center?
Sure. I mean, listen, yes, I think insuring people is good. I think whether or not they come to the medical center or not is almost not the point. I think the point is that there are a lot of people who have trouble now finding quality, affordable health care, and now they're going to have access to it. I think there are things in the bill that are scary for a lot of people because there are a lot of unknowns. How are we going to take this cost out of the system? A lot of the bill is funded with cost reduction. And we all know there's a lot of waste out there, but you have to actually find the waste and target it in the right areas, and there's going to be a lot of conversation about that.
Well, that's a good point, because there's been this talk about how they're going to do that, and the proposal in the Senate at least is to cut down on some of the Medicare reimbursement fees, that are going from Medicare to the providers. And that in concept sounds fine, as you say, cut out waste, but in practice, how do you do that?
Well, that's actually not where the waste is. I mean, the waste is not necessarily in paying doctors or paying hospitals what they're getting paid today. And in fact, there are a lot of other unrelated packages out there to reinforce payments to doctors and hospitals to make sure they don't get cut. But what they're going to do is actually look at how they get paid. And do they get paid for individual treatments that they provide? Are they going to look at episodic care, where they take care of people from the start of their care to the end, rather than getting paid by test?
Will care really suffer because of that?
I don't think so. I think it's actually good for the country. We have a system that's really dysfunctional right now. We're paid per test for everything we do, and I think it's time to take a fresh look at this. The question will be how do you put it all together and make sure you come up with something that doesn't cripple the current system and still rewards innovation, creativity, and
that's one of the conversations that we seem to be having repeatedly, whether we're talking about the financials or talking about the health industry, is that with some of the reform that we're doing, are we getting to the heart of the problem? Are we making the insurance industry a better industry? Are we getting better service to consumers? Are doctors able to do their jobs easier and better and with less stress? Do you think we're able to achieve that with the reform here? Are we going to see some real reform, or like some say, this is not actual reform, we're tweaking the system a little bit?
Listen, this is a $1 trillion bill. We are radically changing how the healthcare system works in this country today. Is it going to work? No one really knows. I don't think it's not going to work. How well it works, well, it remains to be seen.
It's worth the bet, you're saying?
I think, it's worth the bet. I talk to people all day long who are really in crisis and don't have health care insurance, and we really need to do better for them. And I think this is a decent first start. But again, there's enough in there to dislike, and there's a lot in there to like, and we're just going to have to see how this all gets reconciled.
Do you think they tried to balance the two, trying to provide more coverage? And this bill will, the CBO says, provide coverage to 20-some-odd million additional Americans, goes up to, I think, 94% of the country being insured, which is, as you say, that's a good thing, right? With trying to control costs, are they really going to control costs, I wonder, with a bill like this?
They have to. I mean, the answer is if we don't, we're going to go from 16% of our economy to 22% of our economy.
Well, that's what I'm saying. We'll be back talking about this, and like we have been with Social Security and Medicare. That seems to be the concern that people bring up when we talk to them.
We will always talk about health care in this country. I think that the mechanisms in the Senate bill in particular have a decent chance of taking some costs out of the system. I mean, again, we have no choice, because the status quo is really not sustainable. And the future, if we're going to really be able to afford this, we're going to have to take costs out. And I actually think there are ways to do that.
Are there any ways that you're seeing right now that within your own medical center, within the business, that there are changes being made according to what's on the horizon?
It's the best question I've actually been asked in a long time.
Thank you.
No, I'm serious. And the reason is, yes, we've actually started looking at how we deliver care. Now, we haven't changed anything yet because we don't know exactly what's going to happen, but we're starting to have conversations and meetings where we talk about how are we going to treat disease conditions with doctors, and the hospital together to pay. Because if we're getting paid for one illness and one payment, we have to be prepared to be able to accept that payment and pay doctors, and we're starting to talk about it.
Come up with a contingency plan. That's very interesting. Thank you for coming in, Andrew, so early this morning.
Happy to be here.
Good to see you. From NYU, Andrew Rubin with us this morning. Thank you very much. That was good. You do ask a good question.
Well, I appreciate that. We should have Andrew in every day. Don't you think?
Thanks. Well, that was a good measured discussion, too, on healthcare, without any screaming and yelling for a change. Anyway, switching gears here completely, a second Boeing 787